Explaining admission of a patient to the ward too.
From the part 1, this is the part 2. So you have to find out the history of the disease, history of presenting symptoms. If patient can talk, allow patient to tell you. Other than that, the relative can also help. Yes, and you explain all the ward policies to the relative. You tell them the visiting time. You tell the relative the time for ward rounds, the time that nurses go on rounds. You tell the relative the payment policies. That is, if there is an insurance policy, you explain it to them. You let the relative know that the insurance may not cover everything. So upon discharge, patients may still pay some bill. You let the relatives know that if they don't have insurance, they have to pay a deposit so that the patient will be cared for. You let the relatives know that there are some medications that if they are not available on the ward, in the hospital, they have to go and buy it from outside. Yes, you let the relative know all the necessary things he needs to know. Let him know the things that the patient will need while on admission. There are some patients, when they are coming on admission, it's not a planned admission, so they don't know what to bring. But they were just coming, they didn't know they would be admitted. So you have to tell them they need a bowl because they will eat, they need spoons, they need cups, they need buckets, they need a sponge, a towel, everything, all the toiletries that they need. Yes. So you allow the relative to sign a consent. Is that he is agreeing that the patient should be catered for on the ward. Yes, then you have to orientate the relative. If the patient is able, you orientate the relative and the patient. I think this one, she is checking if patient came with any jewelry. Yes, any jewelry, any valuables, any money that patient, that may not be safe to keep with patient. The nurse has to take them and keep it safe and document. Yes, or you give it to the relative upon permission from the patient. So if the patient permits you, you can give those things to the relative to take home. So this one, I think she is calling on the junior nurse to go and take the jewelry. The patient doesn't need the jewelry on the ward. Yes, it's even going to be an agent for it's going to distract the care. So you need to pick them for safekeeping, or you give it to the relative to send home. Yes, so admission of a patient, if you get it as an examination task, you are supposed to do it alone. If you must use an assistant, then you request from your examiner. Other than that, you do everything alone. So you see, this procedure has vital signs embedded in it. It may have serving of medication embedded. It also has orientation. So it's like 4-in-1 procedure. So when you are doing it, you may be rated for 2 tasks. So don't think that it's admission, so I won't do the orientation properly. No. Do it. Don't think that it's admission, so I won't do the vital signs. Well, you have to do it. So because you may be rated for that task as a second task. Yes. So you have to explain everything. I think the relative asked the question. Any question like when he can visit, how long the patient can be on the ward. You need to take time and explain things to him. Patient will be on the ward as soon as she feels better. She will be discharged. Yes, that one you must even tell the relative whether patient they will inquire or not. Yes, and any question, you need to take your time and explain every question, because somebody's wife coming on admission, somebody coming on admission it puts them in a state of anxiety. Yes, so this is it. They should have done orientation, but there's a video on orientation of patients and relative. You should orientate them on the board. If patient is able, patient goes. If patient is not able, the relative. So now the relative can bid their wife goodbye and leave while the admission process continues. So you continue recording of the details. Yes, if you have a system, you are using an information system online, then you continue recording those details on the system. The relative is supposed to leave the world, but I can see he's still hanging around. I think he already misses the wife. So you help patient to unpack her belongings, you help her to dress into a pajamas or a gown appropriate for